Hi, my name is Matthew. Today we're going to talk about arterial blood gases. Arterial blood gas sampling is usually conducted by direct vascular puncture. There is a relatively low incidence of major complications, and it can be conducted at the patient's bedside or in the pre-hospital environment. It has the ability to be rapidly analysed, and it makes it an important tool in determining in determining gas exchange levels in the blood related to respiratory, metabolic, and renal function. It is also used to measure the acidity of the blood and the level of oxygen and carbon dioxide. It also helps check the patient's lung function, how they are able to move oxygen and remove CO2. There are 5 key components in an arterial blood gas. So you have your pH. The normal range is 7.35 to 7.45. You also have your bicarbonate, which is 22 to 26 for normal ranges. You also have the partial pressure of oxygen, which ranges between 75 and 100. You also have the partial pressure of CO2, which normal ranges are between 35 and 45, and oxygen saturations, which I believe are between 94 and 100% for normal. Indications for your ABGs or your arterial blood gases would be identification and monitoring of acid-base disturbances, the need to evaluate the adequacy of ventilation and oxygenation, when there is concern for lung failure, kidney failure, shock trauma, uncontrolled diabetes, asthma, COPD, hemorrhage, drug overdose, metabolic disease, and also chemical poisoning. Contraindications. There are a couple of absolute contraindications that are related to taking the sample of blood gas. So the absolute contraindications are poor collateral circulation to the area. If you have an infection such as cellulitis surrounding the site where you're going to collect the sample, peripheral vascular disease in the limb, and also the arteriovenous fistula as well. Relative complication will be impaired cognition, as the patient might be agitated or move, and you have the risk of damaging the artery. For the interpretation skill itself, there's no contraindications for the interpretation of the skill or complications. Equipment required to perform the skill. So you want to have an arterial blood gas syringe with a needle. Also, you want to have some alcohol wipe, your own PPE as well as a sharps container. For the interpretation side of things, you just have to have an understanding of the normal values of the blood gases and what it means when these values are abnormal. Now, we'll talk about the analysis, assessing the pH of the sample. So if the pH is below 7.35, the patient is acidotic. If the pH is above 7.45, the patient is alkalotic. Examine the PaCO2. This will determine changes in blood gases if they're due to metabolic or respiratory factors when it's combined with bicarbonate. It will give you a full understanding of the blood gases. If the CO2 is below 35, it tends towards alkalitic. If it's above if it's above 45, it tends towards being acidotic. Now, just to talk about the bicarbonate levels, so the normal range is 22 to 26. If it's below 22, it's believed to be alkalotic. If it's below 22, it's acidotic. If the CO2 is above, it's acidotic as well. So if the bicarbonate's above 26, it's alkalotic. So I'll give you some examples. So respiratory acidosis, if the pH is below 7.35 and the CO2 is above 45 and the bicarbonate's normal, you have respiratory acidosis. If your pH is above 7.45 and your CO2 is below 35 and your bicarbonate's normal, it's respiratory alkalosis. Now, if your pH is below 7.35 and your CO2 is above 45 and your bicarbonate has risen to above 26, you have respiratory acidosis with metabolic compensation. If your pH is above 7.45 and your CO2 is below 35 with a bicarbonate below 22, you have respiratory alkalosis with metabolic compensation. You can use the mnemonic Rome, as like the city in Italy, to help determine the relationship between pH and CO2. So the RO means respiratory opposite, and Me means metabolic equal, sort of thing, so the Rome word. Now, the respiratory cause of pH and PaCO2 are altered in opposite directions. Reduce the pH and elevated PaCO2 or elevated pH, respiratory acidosis, and reduced PaCO2, respiratory alkalosis. Metabolic cause, pH and PaCO2 are altered in the same way. Reduced pH and reduced PaCO2 or elevated pH and elevated PaCO2. Assess the bicarbonate to corroborate a metabolic effect. Elevated or reduced bicarbonate will suggest metabolic cause. Consider combined respiratory and metabolic caused. We've reduced pH, increased CO2, and decreased bicarbonate. So you have, if that's the case, you have respiratory acidosis and with metabolic cause. If you have increased pH, decreased PaCO2, and increased bicarbonate, you have alkalosis with respiratory and metabolic causes as well. Now I'm just going to talk about safety and special considerations. So safety, when you're taking the gas, you want to make sure you have your PPE and you have safe sharps handling. Now, special considerations. So the body can compensate in an attempt to correct the imbalance, one system to compensate for the abnormality in another. We examine this by looking at the opposing system, the opposing component of the problem. For example, acidosis, we'll look at what the bicarbonate is doing, whereas alkalosis, we look at determining if the blood is compensating. We'll look at what the CO2 is doing. Now, it's uncompensated if the other system, such as your bicarbonate or CO2, is within normal ranges. Then the problem is not compensated or uncompensated. Partial compensation is if the other component of either bicarbonate or your CO2 has gone outside its normal reference ranges. A component is occurring to assess how well it has been able to do this. We need to refer back to the pH, and if the pH is not within or close to normal ranges, then it is partially compensated. Full compensation is if the pH is back within normal ranges. A full compensation has occurred. Respiratory acidosis and alkalosis, changes in CO2 can be metabolically compensated by increasing or decreasing levels of the bicarbonate in an attempt to move the pH closer to the normal range. Metabolic acidosis or alkalosis, changes in bicarbonate can be compensated by the respiratory system, retaining or blowing off CO2 in an attempt to move the pH closer to the normal ranges. So just to simplify, respiratory acidosis is if the pH is below 7.35 and the CO2 is above 45. Respiratory alkalosis if the pH is above 7.45 and the CO2 is below 35. Metabolic acidosis if the pH is below 7.35 and your bicarbonate is below 22. Metabolic alkalosis is above 7.45 for the pH and your bicarbonate is above 26. Compensated respiratory acidosis is the pH is normal but the CO2 is outside the normal ranges of 45. Compensated metabolic acidosis, you have a normal pH and your bicarbonate is below 22. Compensated respiratory alkalosis, you have a normal pH and decreased CO2 below 35. Compensated metabolic alkalosis, you have normal pH and your bicarbonate is elevated above 26. In your documentation, you just want to have patient details, so times the ABG was performed, the ABG results in your interpretations, summary of clinical conditions when the ABG was performed. You might want to include the set of observations and any interventions that occurred to treat the results. So my name is Matthew and I'd like to thank you very much for listening.